Hi, everyone. I would like to welcome you to the Nuclear Medicine Information Session. My name is Julie Alley. I ask that you please be on mute for clear sound from the presenter, and I'd like to let you know that everyone will receive the slide deck via email next week. Before we get started, the British Columbia Institute of Technology acknowledges that our campuses are located on the unceded traditional territories of the Coast Salish nations of Squamish, Tsleil-Waututh, and Musqueam. This is the format for today's session. And at this time, I would like to hand it over to Thomas Wong, our program head.
Thanks, Julie. Welcome to our info session. So I'll be spending the first little bit here just presenting about the program, and then we'll have an opportunity at the end to ask some questions. And feel free to use the chat if any questions kind of pop up as we kind of go along. So as Julie's mentioned, I'm the program head for the program, and I'll just start off with a bit of an introduction in terms of what nuclear medicine is. So I'm going to take a guess that some of you may or may not have heard of nuclear medicine. So nuclear medicine is a specialized medical imaging field that uses biological tracers combined with radioactive isotopes to produce images that help with the diagnosis and management of diseases. Now, I think the key thing that makes us different from other imaging modalities is that we focus on functional imaging and looking at metabolism of organs. Our scans often show what is happening inside of a body's at the organ cellular and molecular level, which often leads to earlier detection of diseases. Now, our pictures are taken by detecting the radiation from our tracers using a specialized piece of equipment. And our cameras are known as gamma cameras. So there, you may have heard of the term SPECT-CT gamma camera, but we can also do what's called a PET scan using a PET-CT scanner. So on the next few slides, I'm going to share some examples of some common studies that we do in nuclear medicine to hopefully kind of paint the picture of what we might see in our images. So we do a lot of cardiac imaging in nuclear medicine, and these tests can be used to detect blockages in the blood vessels that supply the heart, or you can also do it to evaluate how well the heart is pumping. Now, here's an example of a heart scan where we inject the patient with some radioactive red blood cells and then take a video of the heart to see how well the heart's actually pumping. Now, again, this might sound kind of a little bit like science fiction where we have to take some blood from a patient, label it with some reactivity, and inject it back into the patient. But this test is very valuable and very accurate at assessing the patient's heart function. Now, another scan we do is a lung scan, where we take pictures of the airflow and blood supply to the lungs. And often this test is done to look for blood clots that might be obstructing the patient's blood vessels in their lungs. So the way we do this is that we get the patient, again, sounds kind of science fiction, but we get the patient to breathe in some radioactive gas to assess the airflow to their lungs. Then we put them in their scanner, take a picture of the airflow, and then we inject them with another tracer that goes to the tiny capillaries within their lungs, allows us to assess the blood flow to the lungs. And then we compare the two to see if there's any evidence of blood clots. So this is a very valuable test in a case where it can be deemed a medical emergency on the patient. Now, another common scan that we do is bone scans, where we can look for small fractures, bone infections, or even bone cancer. Here's an example of a bone scan on a patient's left foot, looking for a potential fracture. Now, this is a very specialized type of bone scan, what we call a hybrid scan that combines our bone scan with a CT scan. And it really does a very excellent job at pinpointing exactly where a fracture might be. So I'm going to kind of teach you how to be doctors for a second, a little bit here. So on the left-hand side of the screen, you'll notice that there is a image of a little dark spot there, and that dark spot is potentially evident of a fracture, and that's kind of the tracer that we inject. So it's showing that a lot of the tracers going to that one spot. Now on the right hand side, this is a CT scan, so it kind of looks like an X-ray, but we do a CT scan of the patient's foot, and then you fuse this third image with that first image, fuse them together, and you actually get this hybrid image where you add some color to it, and it really does kind of pop and show exactly where that fracture is. So it's very helpful for the doctor to be able to pinpoint where fractures might be located to help with the treatment. So, so you might be wondering why you're talking about CT scans. So part of this hybrid imaging because our students need to learn it in order to do these scans, you do get some dedicated CT training while you're in our program. And some students even like CT so much that they end up moving on after they graduate from our program into getting a bit more CT training to become CT technologists. So if that's kind of a pathway, this will be additional kind of way that you can kind of get into CT. And I'll talk more about those career opportunities later on. PET scans. So some of you may have heard of PET scans. PET scans are very commonly used in imaging for cancer. BC Cancer is one of the leading areas in our province that's performing PET imaging. This is an example of a scan of a patient with metastatic breast cancer. And what they did was they injected the patient with a radioactive sugar molecule, and then they see where it goes. So this is the kind of black and white image on the left-hand side. That's your PET scan. And all those little dark black spots here, these are all evidence of cancer cells that have spread throughout the patient's body. Now, similar to the previous example on the previous slide, this is a CT scan. We fuse them together, and again, it allows you to pinpoint exactly where those cancer cells have spread. And this is very valuable information to help doctors decide whether or not treatments are working, what type of treatments to use on these patients, and really just to monitor the effectiveness of treatment over the course of time. So PET imaging at BC Cancer is rapidly growing and expanding in our province, and there's upcoming announcements of PET clinics that are opening up throughout the province on the island as well as in the interior in BC. So it's very exciting times for PET imaging. Now, another very exciting area of nuclear medicine is theranostics. And this is a fancy term. This is probably a term you've never heard before, but think of it as combining the word therapy with diagnostic imaging. You get this word called theranostics. And what theranostics is it's the ability to what they found is there's these tracers they can create that can allow you to both image where cancer might be, but also be used to treat and kill off cancer cells. So it's very powerful and effective way of accomplishing two birds with one stone, so to speak. So here's an example of a patient that has prostate cancer, and all those black dots, again, not looking good, are all cancer cells that spread throughout the body. Now, just with chemotherapy and just hormone therapy, so basic things that exist right now, traditional methods of treatment, it killed off some of the cancer cells, but you still see a lot of spots. Now, just after doing 2 rounds of this theranostic therapy and imaging, you'll notice that a lot of those dark spots have disappeared. So it's really showing how effective that treatment is working and how many of those cancer cells are being killed off by this treatment. So this is a very exciting area of nuclear medicine. Before this presentation, I did a quick chat search, like a ChatGPT AI search, and they actually have theranostics raising nuclear medicine as one of the top 10 healthcare professions in Canada. They'll be in high demand over the next 5 to 10 years. So again, very exciting area of for this field. All right, so that's enough examples. Hopefully that kind of gives you an idea of the functional imaging that we do, but let's talk a little bit about some fun facts of nuclear medicine. I usually like to mention that we don't do kind of the 24/7 shift work, so kind of the traditional banker hours, so shifts can start as early as 6 a.m. And usually finish no later than 6 p.m. Every day. They usually are open departments are open Monday to Friday, with some departments opening on Saturdays, but again, nothing that's the kind of shift work that we do. You get to do both diagnostic and therapeutic procedures within our field. It incorporates all the sciences. So you do need to have a working knowledge of your anatomy and physiology, the chemistry, understanding how the tracers, and the physics, how the equipment and the radiation work. So it's really an opportunity to combine all the sciences into one unique field. And there's also the patient care aspect, which is those kind of softer skills where you get to work with that, because that really does become an art, being able to provide good patient care. Working in a hospital setting, most departments, nuclear medicine departments, are within larger hospitals or cancer clinics. You get a high variety of scans each day. You might do scans of the heart, move on to scans of the bone, and maybe do some PET scans too, all on the same day. So a good variety, and the ability to do hybrid imaging. So really dabbling into doing combined SPECT CT, so nuclear medicine and CT imaging, PET, again, nuclear medicine and CT imaging, and in some cases, for example, PET MR, there's a PET MR out at UBC where you can combine MRI with PET imaging. So ability to hybrid imaging is really unique with our field. All right, so what does it look like to study at BCIT? So our students get to learn in our fantastic labs at BCIT. We have a modern SPECT CT scanner. So what you see on the left-hand screen, that's our gamma camera that we have right on campus, fully functioning. And the students get to use and operate the camera during their lab simulations. We also have a radiopharmacy. So the radiopharmacy is where we prepare the radioactive tracers. So on the right-hand side, you see students with an instructor learning how to prepare the tracers. You get to learn how to handle and prepare those radioactive tracers for patient scans. So our labs are really designed to reflect what students will see and use and do in the hospitals so that they are well prepared for their clinical practicums. So here's a snapshot of what our program looks like. So we are a 2-year diploma program. It runs continuously for 24 months. We accept 20 students each year, so that's our class size. The first year is when you take the coursework and learn about some of the foundational knowledge and theory. And then after that first year, you spend your first summer out at clinical, and that's when you get to really start applying some of that knowledge that you learned. Now, recognizing that you can't learn everything all at once, you then come back for your second year, and we have a unique model where we do alternating 2-week rotations. So we spent 2 weeks at BCIT taking coursework, and then 2 weeks out at clinical, and you're doing that that switch back and forth, and it really does allow you to one, it breaks up the school, and also allows you to kind of apply what you learn at school right away in the clinical. You don't have to wait till the very end or wait a good amount of time before you practice. You get to do it right away. Overall, you get to spend about close to 40 weeks worth of clinical within the entire program, and you'll spend clinical placements at nuclear medicine departments in BC, as well as all students get to rotate through BC Children's, BC Cancer, as well as dedicated CT departments for that specialized training. Already kind of spilled a little bit into this next slide. So again, 40 weeks total of clinical. Clinical really does reflect what it feels like to be working a true shift. So you are spending 35 hours per week, so it feels like full-time work. The main clinical sites that we have in our program are in the Lower Mainland, as well as on Vancouver Island and BC Interior. So we have affiliation agreements with multiple hospitals. There is options to additional clinical sites in maybe some of the smaller communities across BC, but we usually limit those to 2 to 4 weeks max throughout the entire program. And each student will work at 4 different clinical sites, and that's in addition to the PET, BC Cancer, and BC Children's rotations. So what does it look like when you graduate? So when you graduate, all graduates need to write the national certification exam. So that's once you pass that certification exam, you become a registered nuclear medicine technologist or also a registered PET technologist, depending on where you work. Again, I also mentioned earlier that some grads even branch off becoming CT technologists. You primarily will be working at the hospitals or at cancer clinics or in CT departments. Wages start at around 36 to $40 per hour and really just go up from there. PET technologists make a little bit more, CT technologists make a little bit more, but really you're kind of looking at that starting wage, and it really does increase with every contract negotiation they get. And mentioned the banker hours, no shift work. CT, if you do work CT, you might do a bit of shift work. That is the nature of that job. But nuclear medicine, no shift work. And our graduates have close to 100% employment rate when they graduate. And a lot of them do secure work often well before they even graduate. So, so the employment outlooks are looking very promising and definitely remain to be promising over the next few years. All right, student testimonial. I wish I was able to have the student join for this session, but unfortunately she's currently out at clinical doing her final clinical placement. So Channy wasn't able to join, but she did share this slide, which I'll just read out to everyone. I know the font's very small, so I'll read it out. And she did provide her email here. So if you do have specific questions about what it feels like to be studying at BCIT and the nature of it, definitely feel free to reach out to Channy. So here's Channy's testimonial. So prior to this program, I did my bachelor's in health science with a minor in biology and psychology. I didn't know what nuclear medicine was, but after doing some research, I found there are so many opportunities for growth in this career path, so I decided to apply to BCIT. Overall, the BCIT program has a very tight-knit community, and despite how demanding the course load is, I found that I always have the support I need in the program from the faculty. And you grow quite close to your peers because you see everyone every single day, and they just become an amazing support system as well. I believe nuclear medicine is an incredible career path. We're not just button pushers. Every day is unique and different. And I think the program at BCIT equips you with all the necessary skills and knowledge and critical thinking to be a nuclear medicine technologist. And along the way, they offer so much support. So again, that was Chandy's lovely testimonial about the program. And I do encourage you, if you have any specific questions about the student's perspective, to reach out to Chandy via email. All right, so now I'm going to spend just a bit of time going over the admissions requirements and how to actually apply to the program. So our applications open every October 1st, and our intake is on September. So we have a new class that starts every September. So as we're sitting right now, our next application cycle opens on October 1st, and we keep it open really until the program fills and we have a good wait list. I will say that for our September 2025, so this year's the upcoming September intake, we have filled our seats and we are in waitlisting applicants right now. So depending on where you are right now, we might be talking about kind of the next application cycle, which opens on October 1st, which isn't that far along. Admissions assesses your application when you apply, and typically within 4 to 6 weeks, they'll have it assessed. And after they assess, they send it over to the program for department review. Our program so program seats are offered in what we call a first qualified, first accept basis until all the seats are filled. And this is a situation where as long as you meet the entrance requirements and you have all the documents in place, apply and we fill our seats kind of according to that first come first serve type basis. So it is an advantage to apply early if you're interested in this program. Waitlisted applicants will also be notified as soon as the seat opens. So when we fill our seats, we start waitlisting, and then we go about moving down the waitlist in kind of that order. Now, once you are offered a seat, typically, or BCIT will ask the applicant to pay a commitment fee to hold the seat. That's not uncommon to post-secondary institutions. So once you pay that commitment fee, you kind of hold on to that seat, and then your tuition fees would be due 60 days before the start of your actual classes. So that's kind of the process that BCIT follows. All right, so this is a slide that kind of shows you what it looks like. I think the first important step, or the first step is probably the most important, is looking at the entrance requirements. So going to our website, seeing the entrance requirements and seeing that you've met them all. And then once you've met them all, ensuring that you have the documentation to support that you've met them all. And then once you have everything in place, then you're ready to apply. So you want to convert all your documents into a PDF format, and then you click on the Apply Now on our website, and that'll lead you to the Education Planner BC. You can also access it directly from Education Planner BC, but all applications are done through that portal, and then they get submitted to BCIT. So very important to ensure that you check the entrance requirements, that you met them all, and make sure that you have the documentation ready to go as well. And it's not to say that you can't take your time. Once you start your application and apply, if you are missing a document, your application will just be marked as incomplete, which means that the department actually doesn't look at that. Doesn't have access to seeing that incomplete application until you submit all the documents. So it is important to make sure you make your application complete if you are thinking of just applying and then getting those that paperwork down the road. All right, so we've talked about entrance requirements. What does that look like? So here's a slide again. This is on the website, and you can see it there. So we do require English 12, pre-calc, math 12, anatomy, physiology 12, chemistry 12, physics 11, and then there's some key forms that we also require, which is an applicant acknowledgement form, and because there's some key requirements you need to kind of acknowledge coming into the program. A mandatory applicant questionnaire. The questionnaire is kind of an opportunity to highlight your unique experiences, achievements, as well as your motivation to apply, why you think this is the right field for you. And something that's kind of new for our next intake, so this is speaking of our September 2026 intake, which opens this October, is we did add in the requirement for volunteer and work experience reference letters. So there again, when over the next few months, we'll be updating our website to reflect that. But that is something that we're adding that's new for that. So if you've applied for this upcoming September, that doesn't apply. This is more for the next intake. Regarding transcripts, to meet the minimum requirements, so again, meeting these 73% requirements that would make you qualified, you do need to have your final grades, but at the very least have midterm grades with your application. Now, the midterm grades do need to demonstrate at least 50% of the overall coursework that's been assessed. So it's not just your first term exam. It would mean that you need to have at least 50% of the course assessments done and submitting those grades forward. So admissions, again, BCIT admissions is what is who looks at those transcripts and ensures that they meet that requirement. So that's something to consider if you're just in the process of completing entrance requirements, that you ensure that it's not that you can't submit midterm grades, but you do need to make sure that you're at the halfway point of that course. An ideal applicant, what do we look for? What supports success? So what we found is that post-secondary education does support success, but it's not mandatory. I think if you have strong academic background and strong kind of grades, that usually does support success. A strong aptitude for sciences. So as I mentioned, our field is quite unique in the sense that it does combine all the sciences, including kind of that ability to communicate well with the patients. It really is unique in the sense that it combines all the sciences together. Good grades from previous education, having a keen interest of nuclear medicine field. I would say that with any sort of program you're thinking of applying for, is do a bit of research, see if it is a good fit for you, see what the day-to-day tasks involve. If you have the opportunity to maybe let's say volunteer or visit a hospital, maybe have an opportunity to interview some staff. That might be an opportunity to learn a little bit more about the field. But definitely a keen interest helps kind of spark that motivation. And then related volunteer or work experiences is a very valuable asset for any healthcare profession. So this is any sort of experience that involves interacting with the general public or with patients in a clinical setting. So if you're thinking of a clinical type opportunity, it might be volunteering at a hospital, working at a care facility, any type of thing like that. Customer service jobs also allow you to interact with public. Those are also very helpful skills to have for healthcare. And again, we do require the reference letters for our next year's intake. Laddering opportunities. So where does this lead you? So, I mean, ultimately it does lead you to becoming a registered nuclear medicine technologist, but a lot of our graduates will actually move on for further education. This may include taking some additional BCIT programs. Some of our grads move into becoming MRI trained, so they'll take the MRI post-diploma certificate. So taking some part-time courses as they're working in nuclear medicine, so they can kind of get trained in both nuclear medicine and MRI. Some of our grads want to continue their education in CT. And our national professional association, CAMRT, offers a computer tomography, so a CT imaging certificate. So again, some additional courses specific to CT. Some graduates want to do degrees, and we have BCIT has affiliation agreements with Thompson River University, so you can transfer some of your credits over to towards a Bachelor of Health Science degree at TRU. BCIT offers a health leadership certificate program, which some of our graduates want to kind of go into more leadership roles in the health authorities. That'll be an option, and as well as a Bachelor of Technology in Technology Management. Again, that's more of a tech-related avenue that some grads pursue. So I know I've talked a lot of information about applications and courses and entrance requirements. I think sometimes your situation might be unique. I strongly encourage you to reach out to our lovely people in the BCIT program advising department, and they can look at what courses you take in, maybe offer some direction in terms of what you might need to improve your application. So strongly encourage you to either scan the QR code or visit the website that's on the screen here. You can book appointments with them virtually, in person, contact through email, phone calls. There's multiple ways of kind of connecting with a program advisor so they can kind of assist you with your application. And now I'll pass it back over to Julie.
Thank you, Thomas. Now, moving from the academics, I would like to let you know that BCIT is committed to supporting students in a holistic sense. We want you to succeed not only in your academics, but also outside of school. Some of the student services are available to you as a prospective student, and others will become available to you once you become an enrolled student. Here are some of the important student services that I'd like to mention. If you are Indigenous, BCIT's Indigenous Initiatives Department is there for you to ensure smooth transition into your first year. They offer peer-to-peer mentorship, a welcoming gathering place, and provide clarification on Indigenous funding. BCIT's awards, scholarships, and bursaries are listed on our financial aid and awards webpage. I'd like to mention that we also have a President's Entrance Award. Selection is not only based on academic achievement, but also on volunteer and community service. Please contact financial aid directly for more information. BCIT has a student health services, a health clinic located at the Burnaby campus. They provide medical care for current BCIT students year-round. We also have a counseling and student development department available to help you enhance your educational performance and maximize your success at BCIT. And last but not least, our recreation services promotes, encourages, and enables the practice of physical well-being. We consider recreation an integral part of campus life and welcome all students to enjoy their services, which include a racquetball court, a boxing facility, like a boxing room, fully functioning showers, sauna and steam rooms. So there's a lot of benefits to coming to campus and using these services. And those are just to name a few. Here we have our BCIT Health Sciences social media handles. If you wanted to catch us on Facebook, we're still using the Twitter icon, but it's X now, Instagram, YouTube, TikTok, and LinkedIn. If you wanted to take a tour and visit the Burnaby campus, spend a day with the program, come to a big info session, attend a different info session, or meet with an advisor, these are all the links. And again, you're going to get emailed this whole slide deck early next week. And now I'd like you to take note of the BCIT Nuclear Medicine Instagram page. If you're on social media, please follow and support the program to see interesting content about nuclear medicine and other exciting things happening in the program. If you want to watch the program video, scan the QR code, watch it after the session, and get a different take on the program and what it's like to learn at the BCIT campus. If you have any other questions or, following this session, you want to clarify anything, please reach out to Thomas, or if it's specific to the program application process, email program advising. And now I'd like to open it up for Q&A. Some people joined us a bit late, so feel free. Oh, I'm going to start with Octavia, but feel free to ask any questions if you missed the beginning or want to review any of the parts. The first question, Thomas, is this a good pathway to the sonography program?
Yeah, so great question. I would say that sonography program and our program is they're separate programs, and that we both offer kind of direct entry. So in respects, it's not something where you can transfer. I will say in the past, there have been situations where after someone has completed the nuclear medicine program, they start working in the hospitals, and they're working as a nuclear medicine technologist. Sometimes there's opportunities where maybe there's a shortage of ultrasound technologists, and the employer may actually pay for someone to go back to take the ultrasound program as a kind of a post diploma option. So there is that option to consider, but again, that doesn't come up all the time. So long answer short, I would say that it's not a direct pathway. I would say if you're interested in the ultrasound program, it's probably best to consider ways of applying directly to the program, because there's really no opportunity to do a transfer. I hope I answered the question.
Thank you, Thomas. Our next question is, the requirement for physics grades doesn't mention whether post-secondary physics courses count. Other subjects specify that 3.0 credits of post-secondary coursework are acceptable. So would college level physics courses count towards the requirement?
Right. So this is again one of those like opportune times where I think program advising can do a much better job of answering, but I will try my best to answer it in this context. Is with the physics 11 requirement, it needs to be a equivalent. So as long as you've taken an equivalent version of physics 11, whether it be at a post-secondary institution or at a community college, as long as it's equivalent, admissions will mark that as meeting the requirement. So unfortunately, there's so many physics courses offered by so many institutions that it'd be hard for me to answer specifically about that. But advising and admissions has like a whole catalog of equivalent courses that is recognized as Physics 11. So I hope that captures the answer. So it's you would need to have a Physics 11 equivalent. We've had cases where someone has taken the first year physics courses and I guess challenge the requirement, saying that it's an equivalent, and admissions reviews those, and they'll deem it yes or no in those respects. So I would say if you have a specific kind of course or combination courses, contact program advising to review that, see if it's an equivalent.
Thank you, Thomas. And in regards to the first question, Octavia said, very good to know, and that answers her question. Thank you. Our next question is, for volunteer requirements, is it going to start for MRI and sonography courses as well? I'm going to reach out and say, I mean, Thomas can answer this, but you'd probably have to go to the program info sessions to find out the specifics on those specific programs and what their volunteer requirements are.
Yeah, I agree with that answer, Julie. Is I can't speak for MRI or sonography. Unfortunately, I'm just from the nuclear medicine program, so it was a decision that we made to add that requirement, and it really is just adding it to really just to understand the applicants better and to see those roles a little better. So, but yeah, I would say direct those questions to MRI or sonography.
In general, however, does the volunteer requirement have to be in a clinical, like a healthcare type of setting? What are some examples of volunteer experiences that could be applied for the nuclear medicine program?
Yeah, that's a great question. So again, I think the key thing is the aspect of interacting with the public, interacting with people of diverse backgrounds. I think that's the important aspect. So when we're talking about volunteer, it doesn't necessarily need to be in a hospital or a clinic or at a care facility. I know sometimes those can be kind of hard to get your foot in the door with those because a lot of people want to seek those opportunities. But we've seen applicants that come in with experience volunteering at nonprofits, and they're dealing with the public, or volunteering at specific, let's say, youth camps or areas where they're working with people of special needs. Those are kind of some additional examples of volunteer work that would be considered assets for kind of that interactive piece. So I think interaction is the key. Is that if you look at the volunteer experience you've had, is what type of interactive role have you had, working with people, alongside people, that type of thing.
Thank you, Thomas. I'll
Any
give it
other
another
questions?
minute.
Yeah.
Uh, I'll give it another minute in case anybody has any questions to ask. But at this time, I'd just like to say thank you, Thomas, for that wonderful presentation. It was very informative about the program, and I'd like to thank everybody that took their time coming in and logging into the session and listening in. Thank you as well. We will stay on the call for another 4 minutes, so please feel free to take yourself off mute or go ahead and ask your questions in the chat. We have a second part to the volunteer question. I have my education from India, but have taken BCIT evaluation for my courses. Can I apply using BCIT evaluation, or does it have to come directly from the institution?
That is a very unique question. I apologize. I'm gonna have to defer that question to program advising, because I think that's a very unique situation. I'm not familiar with the specific documents that they need for that. So I would say contact program advising with your unique situation for the courses and the evaluation you've done, and see kind of what information they might need. It might be sufficient. I don't know. I just think it's best to contact them.
Thank you, Thomas. Is preference given to those who have received recent credit to the required courses?
No preference. So again, as I mentioned, we are a first qualified, first accept admission model, meaning as long as you meet the requirement, we don't have a recency. I know on the website it says that we have a 5-year recency is preferred. It's really just a preference. It's more of a situation where if someone's been out of school for a long time, we just recommend for success that they might do some upgrading and refreshers just to improve, kind of refresh that knowledge so that you improves your success in the program. But as long as you meet the requirement, it really does check the box that you're qualified. You've met that bar.
Thank you. Our next question is, I know it's a general question, but could you clarify the different types of challenges nuke med techs face in the work field?
Yeah, great question. I think so. Nuclear medicine technologists being part of healthcare field, and you may have seen kind of this type of portrait being painted, in a lot of the ads you might see on TV, and just information you might hear from news outlets, is the concept of healthcare workers just being stretched and uh, you know encountering things like burnout and stuff like that. Nuclear medicine technologists aren't immune to that either. I think just healthcare in general has their moments of being busy and the stresses. But I do think that it's improving. I think with the new graduates that are coming out of the programs, they're filling in some of those vacant positions that were held for a long time. It really is improving some of that work standard. So I do think the work environment is improving. Um, other aspects that in terms of challenges, I would say, is keeping up with the growth of the field. I mentioned earlier about the growth in PET and that concept of theranostics that is really starting to heat up in our field. I think one of the challenges is for technologists to continue learning about these new applications, these new procedures, so that they know how to actually perform them when the time comes that it becomes like a day-to-day routine procedure. So I think that is one of the challenges that we try to combat within our program by instilling students with that desire for lifelong learning. It doesn't stop when you graduate. You're still going to be learning on the job. You'll still be learning years into your profession. And I think that just makes it exciting. So I think it really comes down to finding that path that you're excited about, and you'll have that desire to continue learning. Those are
What
just
a
a couple that come
great
to my mind.
answer. Thank you, Thomas. We have Liam. We're just typing up a question. So we'll give him a second. Thank you for the clarification. I would also like to ask if nuclear medicine techs often get called to work under emergencies, or are such occasions rare?
That's another great question. So some departments, it ranges department to department, hospital to hospital. So I would say some of the larger hospitals have what they call on-call, so call technologists. They essentially would be placed on a list saying, okay, on this date, you're the call technologist. And there are some procedures that we perform in nuclear medicine that are deemed urgent type cases. That lung scan I showed, that'll be a case where in some circumstances you might be called in to do some overtime to do an urgent lung scan, for example, on a patient. But I would say that compared to some other imaging fields, it would be a little bit more on the rarer side. So it's not as common. It just depends on which site you work at. And some other communities outside of the Lower Mainland, like if you go into maybe some of the smaller communities where there's nuclear medicine departments, the call might be more prevalent because you just have less staff potentially, in which case you would need to address those urgent cases. Sorry, I'm just gonna do one more point on that. I mentioned CT. So if you do want to work in CT and use nuclear medicine as a stepping stone to get into CT, CT does have a lot of call work. So those are cases where you could be called in for a lot more emergency type cases. You have CT scanners that are within emergency departments that they might call people in for those type of procedures. So it might be a opportunity to make some extra money on the side.
Wonderful. Okay. And I think that brings us to an end for this session. Thanks again, everyone, and have a great night.